New COVID bivalent vaccines are available as of today to anyone 12 years and older, and the government is encouraging everyone to get one. Amid concerns, COVID is yet again on the rise.
With the fall respiratory season upon us, it is now more important than ever before that we continue to look at vaccines and that we continue to get our boosters as soon as you possibly can.
The message comes a few days after the Chief Medical Officer of Health expressed concerns about the rise in COVID cases. He's not the only one.
It's very worrisome right now. I certainly think that it's going to be a much more dramatic impact on hospitals than the last two falls through this pandemic.
Dr. Susie Hoda predicts this will be a tough winter for healthcare. The system has been under intense strain due to COVID and staffing shortages. Now add in new COVID mutations that are starting to show up in Canada, and it could get worse.
The biggest concern with these subvariants, and there are numerous, is their ability to evade immunity. Because of that, they also do render some of our therapeutics less helpful. So they can affect that. They can also result in many more reinfections. So people often feel reassured that if you've had a COVID-19 infection, you're probably protected with immunity for at least 3 months, maybe even longer, some studies have shown. But of course, that all goes out the window when you start having these new subvariants that are able to kind of overcome that.
Do we know if these new subvariants that are emerging, do we know if they're making people sicker?
We don't really see that signal yet, and I think it's still early with many of these subvariants to understand the clinical characteristics well.
Omicron is still the dominant variant in Ontario. Most of its infections result in fewer deaths and hospitalizations, and yet ER wait times have been getting longer. Lack of family doctors and a shortage of staff are two contributing factors. When asked about overwhelmed children's hospitals today, Premier Doug Ford repeated healthcare has to be done differently, and the status quo is not working.
It's not a money issue. We're pouring money in at an unprecedented amount. Just this year alone, we're increasing it by over $7 billion.
There will be no quick fix for the healthcare system. It's been overwhelmed for decades. COVID has pushed it further to the edge. Dr. Hoda's advice? Protect yourself, mask up in high-risk settings, and get boosted. Stats Canada released new long COVID numbers today. It finds 4% or 1.4 million Canadians have experienced the lingering symptoms. Many will need extra health care.